frontal bone is a bone in the human skull. The bone consists of three portions. These are the squamous part, the orbital part, and the nasal part, making up the bony part of the forehead, part of the bony orbital cavity, holding the eye, and part of the bony part of the nose respectively. The name comes from the Latin word frons. The parietal bones are two bones in the human skull which, when joined together at a fibrous joint, form the sides and roof of the cranium. Each bone is roughly quadrilateral in form, and has two surfaces, four borders, and four angles. The temporal bones are situated at the sides and base of the skull, and lateral to the temporal lobes of the cerebral cortex. The temporal bones are overlaid by the sides of the head known as the temples and house the structures of the ears. The lower 7 cranial nerves and the major vessels to and from the brain traverse the temporal bone. The Sphinobone is an unpaired bone of the neurocranium. It is situated in the middle of the skull towards the front, in front of the temporal bone and the basilar part of the occipital bone. The Sphinobone is one of the 7 bones that articulate to form the orbit. Its shape somewhat resembles that of a butterfly or bat with its wings extended. The occipital bone is a cranial dermal bone, and is the main bone of the occiput back and lower part of the skull. It is trapezoidal in shape and curved on itself like a shallow dish. The occipital bone overlays the occipital lobes of the cerebrum. At the base of the skull in the occipital bone there is a large oval opening, called the foramen magnum, which allows the passage of the spinal cord. Like the other cranial bones, it is classed as a flat bone. Due to its many attachments and features, the occipital bone is described in terms of separate parts. From its front to the back is the basilar part, at the sides of the foramen magnum are the lateral parts, and the back is named as the squamous part. The mandible, lower jaw or jawbone is the largest, strongest and lowest bone in the face. It forms the lower jaw and holds the lower teeth in place. The mandible sits beneath the maxilla. The mandible is the only movable bone of the skull besides the ossicles of the middle ear. The bone is formed from a fusion of left and right processes, and the point where these sides join, the mandibular symphysis, is still visible as a faint ridge in the midline. Like other symphyses in the body, this is a midline articulation where the bones are joined by fibrocartilage, but this articulation fuses together in early childhood. The maxilla in animals is the upper jawbone formed from the fusion of 2 maxillary bones. The upper jaw includes the frontal portion of the palate of the mouth. The 2 maxillary bones are fused at the intermaxillary suture. This is similar to the mandible lower jaw, which is also a fusion of 2 mandibular bones at the mandibular symphysis. The nasal bones are 2 small oblong bones, varying in size and form in different individuals. They are placed side by side at the middle and upper part of the face, and form, by their junction, the bridge of the nose. in the human skull, the zygomatic bone, cheekbone, or malar bone, is a paired bone, which articulates with the maxilla, the temporal bone, the sphinobone, and the frontal bone. It is situated at the upper and lateral part of the face, and forms the prominence of the cheek, part of the lateral wall and floor of the orbit, and parts of the temporal and infratemporal fossa. It presents a malar and a temporal surface, 4 processes, the frontis, spinatal, orbital, maxillary, and temporal, and 4 borders. The lateral cartilage, upper lateral cartilage, is situated below the inferior margin of the nasal bone, and is flattened, and triangular in shape. Its anterior margin is thicker than the posterior, and is continuous above with the septal nasal cartilage, but separated from it below by a narrow fissure. Its superior margin is attached to the nasal bone and the frontal process of the maxilla. Its inferior margin is connected by fibrous tissue with the greater alar cartilage. Paired cartilages that support the nasal tip, columella, and nostril ribs, each consisting of a medial crust within the columella, a middle crust, which extends from the columella's lobular junction to the lateral edge of the tip lobule, and a lateral crust that extends toward the piriform aperture. The axis of the lateral crust normally extends along the line that runs toward the lateral orbital canthus. The heliad bone, lingual bone, or tongue bone, is a horseshoe-shaped bone situated in the anterior midline of the neck between the chin and the thyroid cartilage. At rest, it lies at the level of the base of the mandible in the front and the third cervical vertebra behind. Unlike other bones, the heliad is only distantly articulated to other bones by muscles or ligaments. The heliad is anchored by muscles from the anterior, posterior, and inferior directions, and aids in tongue movement and swallowing. The heliad bone provides attachment to the muscles of the floor of the mouth and the tongue above, the larynx below, and the epiglottis and pharynx behind.